Picture this. You wake up dizzy, open an app, and within 60 seconds, an AI doctor triages your symptoms, orders a lab test, and schedules a televisit before a human even steps in. Sounds efficient, but would you trust it? Today we're pulling apart the hype and the headaches behind AI in healthcare. From life-saving speed to algorithmic bias, from surgical robots to hallucinating chatbots. By the end, you'll have a simple checklist to decide when an AI deserves your trust and when you should ask for a human. In a few minutes, I'll reveal the two-word question that instantly exposes whether an AI tool is safe enough to influence your care. Stay with me. Section 1. What AI doctor really means. Clarity first. Let's clear a misconception. An AI doctor is not a steel stethoscope with legs. It's a stack of systems that support care. Triage assistants that guide you through symptoms. Diagnostic aids that spot patterns in X-rays, MRIs, and CT scans. Predictive models that flag sepsis, fall risk, or medication errors before they happen. Surgical robots that execute ultra-precise movements under human control. Ambient scribes that listen during visits and draft notes, freeing clinicians' time. Chatbots for follow-up, medication reminders, or mental health prompts. In short, today's AI is mostly a co-pilot, not captain. The confusion starts when that co-pilot looks confident, even when it's wrong. Up next, 3 places AI already outperforms humans, and 1 place it really shouldn't be left alone. Section 2. Why healthcare wants AI. The pressure cooker. Healthcare runs on scarcity. Not enough time, staff, or money. Doctors stare at screens more than faces. Nurses juggle alarms that never stop. Data volume? Overwhelming. AI promises to triage faster, catch patterns in oceans of data, and automate the soul-sucking admin that drives burnout. For hospitals, that can mean fewer delays, fewer readmissions, and more attention for complex cases. For patients, it promises speed, consistency, and 24/7 access. But pressure cuts 2 ways. It can drive innovation, or push unsafe tech into practice too soon. That's why how we adopt AI matters more than whether we adopt it. In 30 seconds, I'll show you where AI shines so brightly that not using it would be irresponsible. Section 3. Where AI already saves lives. Strengths. Imaging is AI's home turf. Seeing subtle patterns across millions of pixels is what machines do best. Tools help radiologists spot tiny fractures, early tumors, and lung nodules faster and more consistently. In pathology, models highlight suspicious regions on slides so experts can focus. Cardiology, AI can interpret ECGs and flag irregular rhythms earlier than a rushed clinic visit might. In ophthalmology, AI screening for diabetic eye disease helps catch changes before vision is lost. And sepsis early warning systems can prompt intervention hours earlier, when timing is the difference between ICU and home. The pattern is clear. When the problem is pattern recognition at scale, with clean labels and rich data, AI is a force multiplier for clinicians. So if it's this good, where does AI break? The answer could change how you use healthcare tomorrow. Section 4. Where AI fails and why. AI fails for predictable reasons. Bias in data. If training data underrepresents certain ages, genders, or skin tones, accuracy drops where it matters most. Dataset shift. A model trained in a top hospital may stumble in a rural clinic with older equipment. Confounding. It might learn to associate a chest drain with pneumonia, guessing the care setting instead of the disease. Automation complacency. Humans trust the machine too much, skipping checks. Hallucination in chatbots. Fluent words, fake facts. Adversarial or edge cases. Artifacts in an image can mislead a model. Most dangerous? Overconfidence. Both the machine's presentation and the human's belief. A friendly UI can hide uncertainty that a seasoned clinician would feel in their bones. Coming up, The trust checklist you can use to pressure test any AI tool from an app to a hospital system. Section 5. The trust checklist, your safety net. Use this trust checklist before you rely on any health AI. T. Transparency. Do they state what data it was trained on and where it works best? R. Risk controls. Can you see warnings, confidence levels, and human review steps? U. Updates and monitoring. Is it audited, recalibrated, and monitored for drift? S. Safety evidence. Is there real-world validation beyond a demo? Any peer review or published evaluation? T. Team in the loop. Does a qualified clinician oversee decisions with clear accountability? If the vendor or clinic can't answer these, you've found a red flag. Next, I'll arm you with 7 patient power moves to make AI work for you, without becoming a data scientist. Section 6. Patient power moves. What you can do today. Here's how to stay in control. 1. Ask, what is this tool meant to do and not do? You want scope and limits. 2nd, request the confidence. What's the certainty of this output? 3. Get the alternative. What would a human expert consider next? 4. Bring your data. Medication list, devices, symptoms. Context reduces AI mistakes. 5. Watch for language traps. Human-sounding chatbots can overpersuade. 6. Keep receipts. Save summaries, who approved the plan, and what to watch for. 7. Know your opt-out. You can request a human-only review. And that 2-word question I promised? Ask, who's accountable? If the answer isn't a human name or role, pause. But what do doctors really think of AI? The answer might surprise you. Section 7. The clinician's view. Co-pilot, not captain. Most clinicians don't want a robot to replace them. They want a tool that catches what busy eyes miss. The dream. AI handles paperwork, flags warning signs, and surfaces evidence, so doctors can spend more time with patients. The fear. Black box decisions, workflow friction, alarm fatigue, and liability for machine errors. The best setups treat AI like a junior colleague. It proposes, the clinician verifies, and the patient remains the center. Teams that succeed build guardrails, clear escalation paths, second reader policies for critical findings, and shadow periods where the AI is monitored before it affects care. It's not magic, it's discipline. What about the riskiest edges? Mental health, kids, and surgery. That's where trust is truly tested. So, can you trust a robot with your health? Sometimes, yes, especially where AI does pattern recognition under human supervision. But trust must be earned with transparency, oversight, and evidence. The right move isn't blind faith or blanket refusal. It's informed acceptance. If an AI tool makes your care faster, safer, and more personal, with a human accountable, lean in. If it's opaque, pushy, or untested, opt out and ask for a human-led review. Your action today. Save the trust checklist, and in your next visit, ask one question. Who's accountable? If the answer satisfies you, great. If not, you just protected yourself. If you found this helpful, like, subscribe, and share this with someone who's anxious about AI in healthcare. Comment below. Would you let an AI triage your symptoms or read your scans? Why or why not? And if you want a follow-up, I'm thinking of doing how to read an AI report in your patient portal. Tell me in the comments.